My name is Terry Tsang, and I am an optometrist here in Southern California. I graduated over 20 years ago, and I first started my career teaching at the local optometry school in the area of cornea and contact lenses. So I still provide general care, and I still treat and have enjoyed treating specialty contact lens cases. But my area of true specialty is within the area of neurovisual rehabilitation. I really enjoy working with patients who have visual problems that get in the way of their daily function, and I provide rehabilitation services to get them back to where they want to be. So the first entry was really a referral from another low vision doctor. She had a patient who presented to her with visual snow, and he was looking for filters, light filters, to try to help decrease his symptoms. What she recognized was he was a really young, healthy guy who had perfectly 20 good vision. And he was so debilitated by his symptoms that she was concerned that filters wouldn't help him enough. So I do a lot of work with neurovisual rehabilitation for patients who have had concussion or some post-trauma with visual symptoms. And I've had great success with this kind of therapy. So she reached out to me and just wanted to know, is there anything that I could do for him? So my goal is always to help a patient as much as I can. So when I first met with him with our discussion, what I realized was a lot of his symptoms, the double vision, the visual trails, this dots in his vision, there's enough overlap with post-trauma vision syndrome, which is another post-concussion problem, that I felt I could also help him with neurovisual rehabilitation. And so that's really how I started with my first one. I had heard of visual snow syndrome in the past, and I had patients who complained of dots in their vision, but I never met one who was so debilitated by it that I felt the need to actually, quote-unquote, fix it somehow. So that's how it started. What's interesting to me is that because visual snow syndrome is such a not well-known disease, that these patients are doing their own research. And they're trying to find solutions for themselves when traditional pathways of doctors aren't giving them the answers that they need. So when I helped one patient, he reached out and tried to share with his community about the work that I did, which led to the next patient, which led to the next patient. So this is how they're finding me. And because my mission is to help people when they have a need, therefore it's my mission to help patients who come to me, and I know I can help them.